Okay, guys. So in today's video, it's a shortened version of the Sports Nutritionist podcast that you can listen to on iTunes or Spotify. And my guest was Dr. Cliff Harvey, a fellow board member of the Sports Nutrition Association. He's also a researcher for AUT, Auckland University of Technology, and he is the founder of the Holistic Performance Institute.
I see it in forums and on Facebook groups and things all the time. I'm getting, I can't recover and I can't perform and all this kind of stuff. How can I change this? And what they're really asking is, how can I change this within my low carb diet? And I typically jump in and get a lot of flack for it by saying, eat more carbs. It's not brain science.
So in this, Cliff first fleshes out what carb appropriate nutrition is and starts dispelling a lot of the myths around carb appropriate nutrition and what that looks like.
I think the biggest misconception out there is that, and this arises from the fact that I've done research in low carb and keto, right? So people think that when I'm talking about carb appropriate, or they hear that idea of carb appropriate, that it's about low carb and that's what's appropriate. Or if they're looking at a spectral sort of idea, that carb appropriate pertains to the spectrum of low carb diets. But as we discussed earlier, it's broader than that. It includes everything, right? And so in some respects, it's a catch-all. So it loses a bit of its meaning, except for the fact that it's important to recognize that there is a spectrum, number one. Number two, that there probably are some physiological indicators that might help to predict what type of diet someone could follow for best results. But also that is only true in the context of that person's psychosocial dynamic and their entire lifestyle and their food environment. So it really speaks to that spectrum. And so when people categorize it as, low carb, or you're a low carb guy, or because you're a keto researcher, that's what your focus is going to be, that's a complete myth, because, we know absolutely that there are people that thrive at either end of the spectrum. Most people are probably somewhere around the middle. And it's really about recognizing that.
And then within carb appropriate nutrition, it's not just like the total amount of carbs that you're having that is up for contention. It's also the types of carbohydrates that you're having as well that come under fire. So Cliff delves into that as well.
Right. The only other myth and misconception that I can really think of is that people think the carb appropriate idea might also be about, well, it's not the carbs that are the problem, it's the types of carbs you're eating. Those two statements are true to some degree, but they're also incorrect, because carbs aren't the problem, right? Carbs are never the problem. It's someone's entire diet with a little d and lifestyle environment that can be an issue for their health. When we get tied up too much with the physiology, I think we forget that sometimes perfection can be the enemy of progress. And the best diet for someone's physiology is not always the best diet for them. Put it in the example of, if you have type 2 diabetes, you're with obesity and you're needing to really get on top of your health status. I think a lot of people would be on board with saying, well, probably a low carb diet is going to be appropriate for you, and it's probably going to be very effective. But if you hate eating low carb, then you're not going to stick to it, right? And so that's where it opens the doors to culture, society, family, or whānau, as we'd say here, the psychosocial environment. So it's really looking at the whole context of the individual and what are they going to be able to do to get optimum results.
He then spoke about his professional pathway up until this point, how he started as a personal trainer, then progressed into naturopathy, then into practicing sports nutrition, working with some Olympic level athletes, professional fighters, New Zealand rugby league players, and is now working, for lack of a better term, as like a bit of a Dr. House in clinical nutrition, specifically with people with autoimmune diseases and autoimmune conditions.
And like many of us in the nutrition field, I started out as a personal trainer, strength coach, nutrition coach, and then sort of developed into a sports nutritionist and then clinical nutritionist over time. A fairly rapid sort of progression, but that was the process. And I know a lot of people go through that process as well. So like I say, that was back in the late 90s. I initially studied fitness training, which included strength coaching, nutrition, basic nutrition, sports nutrition, those types of things. And within A very short period of time, really within about a year, I was working with a lot of top athletes, people from our New Zealand Rugby League team here, a lot of professional athletes. And at that stage, rugby had just gone professional. We're talking about that long ago. And then over the years, worked with a lot of Commonwealth athletes, Olympians, world champions, particularly in the spaces of, initially it was weird because I was working with a lot of endurance athletes, but also a lot of, combat and contact sport athletes. Which is more sort of my bias, where I, did a lot of my sport and still do. So through the years, I've worked a lot with fighters in particular.
Then Cliff spoke about his educational pathway, how he started again within fitness, but then went into naturopathy and some more of the alternative health-based sciences, to then circle back into more formal academia with his master's and then his PhD in ketogenic diet and low carbohydrate dieting strategies and interventions for people.
Although now I predominantly focus on clinical nutrition and have done for, quite a few years. So I still have my hand in sports. We obviously teach sports nutrition at my institute, but I practice as a clinical nutritionist, and predominantly now I'm an educator and researcher. So post those early days, I moved through some esoteric stuff. I studied naturopathy. I did an undergrad in naturopathy, went on post that and did a lot of modality work in mind-body healthcare and mind-body medicine. Started my post-grad journey in mind-body healthcare. So I did my early post-grad in mind-body healthcare, then sort of circled back to nutrition for my master's and doctorate. And for those, I really focused on this idea of carb-appropriate nutrition, which I guess is what I'm probably most well known for, if I'm well known for anything at all.
Really interesting number of cases that he started working with in the autoimmune disease sector clinically. More recently, he spoke about what the intervention that he chose and how a sports nutrition or an applied sports nutrition intervention that was considerate of energy availability really helped him get a positive result with these people.
And so recently, it was just a weird thing. I saw a few clients in a row that had what was fairly intractable sort of IBS. They'd been to docs and nutritionists and naturopaths, all sorts, trying to figure out their IBS. And to a person, now this isn't the case for all IBS cases at all, but for these people at least that I was seeing, it was really interesting because I looked at what they were doing, and it was typically, lower carb, aggressive fasting, and a lot of restriction, because they were trying to pull things out of the diet because they thought they might be reactive to it. Now, sure, there's going to be some potential intolerance issues, things like that with IBS, and either healthy people, whatever, athletes, anyone with IBS. But what's super interesting is that in all those cases, I made their nutrition plans less restrictive, less aggressive in terms of the fasting, more food, greater frequency of meals, all those various things to upregulate their energy intake, because I had a strong suspicion that they were underfueled.
Yeah.
And that was driving the stress picture that had a big effect on gut motility and function.
Cliff then started to touch on why considering a psychosocial dynamic of a client is really important, why practitioners should really be considering that as it relates to their nutrition programming and interventions with their clients moving forward.
I've reviewed a number of papers recently that are looking at diet interventions, but they're not really looking at the diet as, it's not important to these studies whether the people actually adhere to it to some degree.
Yeah.
It is important, but it's not important whether they actually end up hitting particular macro content or energy or whatever, because the idea is that it's about the delivery of the system and whether that gives results. So what people actually do is less important than whether they're getting results to some degree. Now, of course, what they do is going to influence results. We all know that. That's a given. But it's a good example of that is one of the papers we published. We compared 3 different low carb diets. Overall, the lowest carb diet performed best for whatever reason. It's probably just because, that's like the bookend type theory. Generally people are more satiated, auto-regulate, all that kind of stuff when they're following either really low carb or maybe really low fat. Right. Those seem to be the most in terms of
there's the smallest parameters for I guess like error margin, so they have to be really strict.
On that lowest carb diet though, a lot of the press and social media sort of attention that came out about that said that that seemed to perform best. There wasn't that much difference between the diets actually, but it seemed to perform best, but people found it hard to adhere to it. And I took a little bit of issue to that not because they were wrong. It was harder to adhere to. People didn't hit the target of 5% calories from carbs. They typically ended up around 8%. But if they got results, it doesn't matter that they couldn't achieve 5%. The intention to achieve 5% took them to 8%, which got them a particular result.
Yeah.
Now, whether it is actually better overall, it's pretty washy because, like I say, the effect between diets is generally pretty small anyway. So, but it's not that the adherence is sort of bad because people don't achieve a target necessarily. That's what I'm kind of getting at. So really the point is that often as practitioners, what's more important is having a structure that gives results, not necessarily a structure that is then rigidly conforming to what we think it should be in the process.
Yeah.
Because that's actually just the doing that ends up being.
Finally, we touched on the importance of qualitative data in research and why qualitative feedback through research is really important, and how to critically think and distinguish between the differences of qualitative research and its relevance in pragmatic application.
We published a qualitative paper that was shared around a fair bit because it's seen as being quite novel. And it's seen as being quite novel, but it's also qualitative research is looked down upon. Now, I think that's crazy because it's not about one or the other. We're not casting it's not a competition between qual versus quant. Often the qual research that is done is embedded within quantitative research. Why do we want to see the qualitative stuff? Because let's say we've got, let's say someone's looking for muscle gain and we've got two diets and we're comparing them and they end up being identical.
Yeah.
Right? They both gain the same amount of muscle. So they're identical in terms of outcome. But if we also did some qualitative research and people on diet A felt way better, just in terms of their subjective feelings, their experience of life, was better, then arbitrarily, that's better. Not arbitrarily, empirically, that's better.
Yeah, legitimately, it's better. Yeah,
absolutely. Yeah.
Qualitative to me informs pragmatism more, like pragmatism to the individual, more so than what quant does.
Yeah.
Especially in terms of how I deliver it.
That's a really good point.
And that's it. So to catch the full episode of the Sports Nutritionist podcast with Dr. Cliff, make sure to listen to us on iTunes and Spotify. And if you need to find anything with Dr. Cliff, he can be found on Instagram at CliffDoggyDog. CliffDoggyDog. And you can find him by contacting him through the Holistic Performance Institute. So holisticperformanceinstitute.co.nz.